I'm excited for today's podcast. We are talking about something I don't know a ton about, which is FASD. I started my career at a center that did mostly opioid treatment, so I know a lot about babies who are experiencing withdrawal after they're born, but I don't know a lot about the alcohol exposure within utero.
It feels like a lot of people don't, and feels like that's why this is a really important conversation we're going to have. So I'm looking forward to chatting with Lauren. Welcome to Connections, the podcast from addiction professionals of North Carolina, where we explore addiction through the lens of policy and practice.
We're your hosts, Sara and Morgan Coiner, and we're here to help you see how it all connects. Today on the podcast, we are live from Lake Junaluska. We are at the North Carolina Prevention Conference. It is the only conference in our state that focuses specifically on substance use prevention and supporting those professionals doing that frontline substance use prevention work. We are joined today by Lauren Borchert. She is the program manager at Proof Alliance NC. Lauren, welcome to the podcast.
Thank you so much for having me. I'm really excited to be here.
Of course, we are so excited to get into this conversation. To start us off, can you tell us a little bit about Proof Alliance NC and how you got involved in this work?
Sure. So it actually starts back to 2005 when I was the executive director for the ARC of Mecklenburg County, and we had a grant through the Mecklenburg County ABC Board to do prevention of fetal alcohol spectrum disorders. And I grew a committee way back then, and it was really the first of its kind in the state. And that is when I met Amy Hendricks. And at the time, Amy was with FASD in NC. She was running that program. And we immediately teamed up. And so we go back to 2005 era. And we started just collaborating on all sorts of things together. It eventually led to me leaving the ARC of Mecklenburg County and joining the ARC of North Carolina, which is where we were able to bring FASD and NC to the ARC of North Carolina as a program. So it was with Mission Hospital prior to, and now it's with the ARC of North Carolina as one of its advocacy programs.
Wow.
That's awesome.
So for our listeners who might not be familiar with the ARC, can you just do like a 30-second commercial about what they do?
Sure. So the ARC of North Carolina is an advocacy organization for individuals with intellectual and developmental disabilities. We also provide an array of services that support those individuals with disabilities, whether it be housing or guardianship or kind of direct care services. And we are throughout the state. We are a large service provider, but advocacy is at our core. And we love to educate folks also about intellectual and developmental disabilities, which FASD is.
I was just going to say that.
Yeah, I love it. It all comes together.
Connects, right?
Yes.
A lot of people, I think, don't know about FASD.
That's right.
Certainly, they may have heard about fetal alcohol syndrome. I think we used to call it that. Now it's fetal alcohol spectrum disorder. Mm-hmm. But we don't really know much about it in the general public. We in the field might know more, but the general public doesn't talk about it. So give us a little bit more background on it.
Sure. So fetal alcohol spectrum disorders is a spectrum, much like autism. And so you have several actual diagnoses that are underneath that umbrella, and they can range from effects. It is the only preventable intellectual and developmental disability that we know of.
Wow.
But it is a brain-based disorder. So even though it can be prevented with the right information and support, there is no cure. It's a lifelong disability.
So it might have been from y'all at Proof Alliance, but I saw a sheet one time and it was like ADHD, anxiety. It listed a bunch of conditions and then it had FASD next to it. And it was all the same symptoms.
Yes.
And it was talking about how often it is misdiagnosed.
Yes.
Can you talk a little bit about that and why that happens and maybe how we can prevent that from happening?
Sure. Well, we're still learning a lot about fetal alcohol spectrum disorders. And I think that is partly why it isn't as diagnosed as some of the others, but it is often misdiagnosed as autism, as ADHD, even with some mental health disorders. There's been some either a co-occurring diagnosis or a misdiagnosis with anxiety. Sensory processing disorder is another one that's often misdiagnosed because when a baby is exposed to alcohol in utero, it can affect so many different systems, but mostly the central nervous system because it starts the development at 3 weeks and it goes through the entirety of the pregnancy. And so when you have someone that has sensory processing delays, or sensitivity to light, sound, those types of things, maybe difficulty sleeping, it's often looked at as a sensory where it could be fetal alcohol spectrum disorders or some sort of alcohol exposure that occurred in utero. But because people know more about autism, ADHD, it typically gets diagnosed in that way. And there are a lot of services that are available for those that are on the autism spectrum versus those that have an FASD. And so we're working towards expanding services for those that have that diagnosis. But there's a lot of different factors at play as to why people don't get that diagnosis and get misdiagnosed.
I wonder, and you may not know the answer to this question, but when we go back to our education for doctors, for social workers, for clinicians, do they get any information on FASD?
It's getting better, but it's nowhere near where it should be.
Yeah.
But I have heard countless times that from medical professionals that, oh, this was barely covered, or, oh, well, we're talking about maybe adding that to the curriculum now. So we do try and attend different conferences for medical professionals like the North Carolina ACOG meetings to talk more with students who are going into the medical field, just so that they can see us, have some sort of exposure to Proof Alliance NC's work and what FASD is if they're not getting that in the school setting. So it leaves a lot to be desired.
Yeah. I do have a question, and it may be a very simple answer. Is fetal alcohol spectrum disorder specific to alcohol? Because I know there are drug exposed pregnancies with opiates and cocaine or whatever. Do those show up the same way, or is this very specifically we're talking about alcohol and only alcohol?
Alcohol and only alcohol.
Okay.
Right. And it's maternal alcohol use as of right now. There's interesting research on the horizon about paternal contributions, but nothing definitive yet. So it is about the maternal alcohol use during pregnancy.
I bet one of your favorite myths is I can drink a glass of wine every day while I'm pregnant and be fine. And that's what the research has told me. It kind of reminds me of when people are like, oh, like 1 glass of red wine is great for your heart. Mary, I bet you hear that all the time.
Sure.
And I want you to dispel it for us. Like, tell us what the truth is and how much alcohol can you drink during pregnancy?
Yep. Really 0.
Right.
Yeah. If you want to be absolutely safe, ensure that you're not going to have an alcohol exposed baby, no alcohol during pregnancy for that full 9 to 10 months, because we like to say 9 months, but it's really 10.
Yeah.
So yes, no alcohol, and all of the big groups, the CDC and the Pediatric Associations of America, they all agree that no alcohol is best for pregnancy. And yes, I do hear that all the time. I hear a lot of, well, my doctor said from time to time a glass of alcohol would be fine. You don't know at that time what is developing that could be impacted. You also don't know the other factors that are going into play in that pregnancy, the overall health of that pregnancy, which it could, maybe genetics. Maybe it's a geriatric pregnancy. Maybe the mother's health isn't the best, or her diet isn't the best. So there's a lot of factors that go into play to kind of help not protect the fetus, but also to kind of help make sure that the pregnancy is as healthy as it can be. And when you're rolling the dice, you're playing a game that you just shouldn't play. There's no need for it.
So the numbers in general around women drinking in general are going up.
Yes.
We're seeing females drink more alcohol, are catching up to their male counterparts.
Yes.
But we have women of childbearing age that we need to get the message out to them about some of these dangers, what we know, because this is something that if the numbers are going up, there's a whole group of women that potentially could be putting children at risk.
Yes.
Right? Their unborn child. So how do you get that message out there?
Yes. At Proof Alliance NC, we are doing a lot of different types of marketing to really try and reach the masses and dispel some of the misinformation out there. Some of the ways that we're doing that is to advertise along the ways of the social districts across the state, which have really caught wind. And so we do these fun things called clean graffiti stamps. And so it's where we take a stencil and we lay it on a dirty sidewalk and we wash that dirty sidewalk with water. And it says alcohol and pregnancy do not mix. We have the proof because we're Proof Alliance NC. Then we have our logo there. So hopefully it'll get people to A, think, and then B, Google us, so that you can see the proof. Because everything that we put out, whether it be our trainings or any of our marketing materials, we have sourced that information because we want to live by that motto. We have the proof.
So the other thing I think that you guys do really well is you have a mocktail. I think you have is it every month? A calendar. Yes. So you have different mocktails. Yes. We've used them. Previous APNC conferences, we put out the coasters with the mocktails. I had them at our events. Mocktails seem to be catching a little bit more. So that's a great thing.
It's a wonderful thing. You know, alcohol-free does not have to be boring.
Yep.
But, you know, sometimes when you're out and if you are expecting or if you are just, you know, sober curious and you're out at an event and maybe it's the holidays or something special, someone celebrating something, you don't want to just be standing there maybe with just like a glass of water or nothing. You know, and, you know, people are nosy. Sometimes they'll ask inappropriate questions about, well, why aren't you drinking?
Right.
None of your business. You shouldn't be asking that.
I don't feel like it. Right.
But so, you know, if you can have a fun drink in your hands, it negates some of that unnecessary, you know, gawking looking comments. And it helps you feel like you're a part of the fun still. And so we have every month on our website, there is a different mocktail recipe that you can look up. The recipe is there. We also do a mocktail series with Our State magazine. So if you go to their website and you Google Magnificent Mocktails, up will come a bunch of different YouTube videos for different recipes. And it shows a bartender in Greensboro, Mark Waddell, yes, and he is making these for us. And they're beautifully done. And then we published an article in September of last year for FASD Awareness Month. And it was the North Carolina Mocktail Trail. And so it highlights restaurants from the west to the east that are really known for their great mocktails.
Oh,
that's great marketing.
We have got to get
I was like, I'm going to need to talk to your marketing manager.
That's me.
Great. Well, we will be talking after this because I love the creativity and it really is like a very public facing. The work you're doing is very public facing. Like it's not for the field, while the field benefits certainly, but it's like, no, you're educating the public.
Yes.
And so you have to be catchy.
Yes.
And so y'all are doing a really great job with that.
Well, thank you. I appreciate that. You know, one of the things that we have really learned over the years is that people that are expecting, they talk to their friends more than they talk to anyone else. They don't necessarily talk with medical professionals. And we actually just did a study last summer that kind of backs up some of what we were thinking anyways. And so if we can, again, I say this over and over, but combat the misinformation with the correct information in fun ways that's going to reach the general population, then I think that benefits everyone.
What's the response you've had? Sorry, Morgan.
Nope, you're good.
What kind of response have you been getting?
Overwhelmingly positive.
Good.
People really want, like we also, in addition to a lot of the marketing, we do trainings across the state. And we have a training team and they work very hard. And, you know, we've trained in the last 2 years over almost 5,000 people. We have about to bring on another 10 trainers next month to expand that as well.
One of whom is an APNC staff member, which is exciting.
I know, we're so excited.
Yeah.
And so we are able to get out into different pockets of the state that maybe, we wouldn't necessarily be able to, but to provide that sourced material, but in a fun way that doesn't feel overwhelming or stigmatizing, but just generally educates, different people in different professions about how they can make an impact and reduce alcohol-exposed pregnancies.
The central nervous system starts developing at 3 weeks.
Yes.
So how do we account for even like accidental exposure?
Sure. Well, we say, it's never too late to stop.
True.
Right. And there's other things, of course, your prenatal vitamins, your diet, and things like that can help with other aspects of the pregnancy. But it's really about educating folks about, and I'm not trying to be any kind of way, but, the importance of planned pregnancies.
I was going to ask if y'all get into pregnancy prevention and any of that.
We
or if
tread
you have
very
partners,
lightly on any of that, but we do just think it's important for people to know where they are with their physicalness and their bodies and what's going on. And if you are consuming alcohol, then to take the appropriate actions to prevent an alcohol exposure.
Well, and when you think, too, about women who experience infertility, one of the first things their doctors often say is stop consuming alcohol.
That's right.
Because it can also interfere with your ability to get pregnant. So it kind of, you see how some of this starts to go hand in hand. We like to pretend that a small bout of alcohol is okay. We're starting to learn that there's the link between alcohol and cancer. And there's so many ways that alcohol poisons our body.
That is correct.
And so while I would never be like, everybody should never drink ever, because I think that's very unrealistic.
Sure.
We do see how it very much intersects with our physical health and particularly fertility and pregnancy.
Right. And, here at Proof Alliance NC, we're not anti-alcohol.
Sure, yeah.
We just want to make sure people have the best knowledge about it as possible for the health and well-being of our citizens and our families as we grow them. You don't know what you don't know. But if we can start to filtrate out our message, then maybe slowly we will really make a big impact here.
Well, and I think it's helpful, like you say, right up front, there's no safe amount. And so that's that bottom line message that we need to get out there, that we know that there's no safe amount during pregnancy.
Right.
So we continue to remind people of that. Right. I think that's really important.
And I think people might be surprised to hear that of all of the substances out there, that alcohol is the most damaging to the development of a pregnancy.
When you talk to our professionals that are in the treatment side and you talk about detox, it's one of the most dangerous detox without a medical connection. So it makes a lot of sense when we talk about it's the most damaging
and the most accessible and the most, right? Like we
don't misunderstand.
Yeah.
We're also not suggesting other substances are helpful during pregnancy either,
right.
But it is the most accessible. It is the most
And that's what makes it confusing is because, you think, well, it's legal. Mm-hmm. I can buy it at a convenience store.
Yep.
Well, and there is this, we talk a lot about, we love to stigmatize even within our field. Well, at least I'm not doing heroin. Mm-hmm. At least I'm not doing that. Like,
right.
Yes.
Right.
Sure. But also, like, we're starting to pit substances against each other, and none of that's helpful or constructive, right?
Right.
It's damaging the baby.
Right.
Period.
Right.
Right.
Yeah.
And, with alcohol, it's causing brain injury. It's brain damage. And so that's, irreversible.
Yep. So I think the other piece that is important, it's been a few years since I've seen this statistic, so probably have to fact check me on it. But it had been a while ago that I was talking to an FASD provider, and they said at the time it was something like the average cost to the healthcare system for one FASD child was in excess around $500,000 just in their healthcare costs. And it was not even in your educational system or some of the other services that they need. That was just straight healthcare costs.
Right.
And I hate to always bring it back to money, but when we talk about public policy,
yes,
we have to talk about what also does this do. I mean, that's impacting our healthcare system. And that number is probably low as our healthcare costs have gone up.
Well, y'all know money drives change.
It's in the millions of dollars.
See, just say, it's been a while since I heard the number.
If you think about it, just raising, I mean, I hate to say the word typical because no one is really
Right.
But that's in excess of $1 million to raise a child of, disability or not.
It's important, I think, to talk about that, the economic side of this too. There's a human cost, there's an economic cost, and where those dollars can be spent to keep people well. Right. If we were able to divert them.
Well, that's the importance of prevention.
Yep. At the prevention conference. Well done.
Yes.
Great job.
We teed her up for that.
Right. Yes.
It's interesting because we get funded from DMH, DD, SUS, DD, developmental disabilities, SUS, substance use, and we don't always talk about how they overlap.
Yeah.
And this is a very obvious one.
Yes.
It's the most obvious place where our fields intersect.
Absolutely. And, it's interesting. I started on the IDD side because I have a family connection. My aunt has autism, and my grandfather was a part of the ARC of Mecklenburg County years ago. And so my connection was straight up IDD, and that's, the direction that I was taking my career in. And then when I got into the FASD world, I just thought, gosh, there's so much here. There's so much potential, and there's so much that needs to happen, and we need to educate and combat all these myths. And then I was lucky enough to find funding for it.
Yeah.
And it's a great way for me to, have both the IDD and the SUS world, combined into this program.
Yeah. And we're sorry.
No.
I was just going to say, we're at this conference today, and that is funded by the Department of Health and Human Services, the division as well. And it's awesome that that's something they recognize.
Yes.
That they want to invest in this because they also know, right, if we can prevent it.
Yes.
What our state is going to look like in 10, 15, 20 years when a healthy group of kids grows up.
Well, sure. But it's not to discount those that, do have or living with an FASD. There's so many across the state, and we have to get better at not just, taking care of them, but helping them to live their best lives and be as productive as they can be and want to be. And so I'm an advocate for that. And while I focus, my efforts, of course, on prevention, it's not to discount the need for intervention and services and supports for this particular population, because it lags behind so many other diagnoses, which is what I touched upon earlier when I said all of the different misdiagnoses. We have some gaps here that we need to address, and even our diagnostic capacity at the state level is sad. We really only have 2 places that you can go, and I'm thankful for those 2 places, but that's overwhelming for those providers. And so I'm hopeful that there will be some federal legislation that is passed to help funnel down some funding to the states to help those that need a diagnosis, get a diagnosis, to get access to services, but also to collect better data on fetal alcohol spectrum disorders, because we lag in that as well. I want to know how many folks are living in North Carolina with an FASD. We don't have that information. We need to know that information.
Yeah.
It sounds like there's so much more for us to do, but we are doing something, and that's really, really important too, that we are getting that message out there. We, of course, are grateful for the work that you all do, and we're just excited that you're a partner in this effort with us.
Excited to be a partner with all of you.
It's fantastic. I'm thrilled with seeing the work, from the mocktails to the marketing, and just being able to be on our platform and be here on this podcast to talk about it. Because like you said, we have to get the message out in multiple ways. And don't we know that about prevention?
Don't we know?
Yeah.
Don't we know? Sara and Morgan, I can't thank you enough for having me.
Of course. Thrilled to have you right after your presentation and continuing the conversation with us.
Well, glad to do it.
I think that was a really important conversation that we don't have enough of in this country. There's so much alcohol in everything we do in this country, and we don't talk about that connection to pregnancy. So it's just critical. I'm so glad we were able to chat with Lauren about this.
Yeah, absolutely. And I think it's so clear in how she talks about this that really their mission is about getting evidence-based information out there, the proof, as they call it.
Yes.
And it's really great to hear her talk about just the very factual nature of this without judgment, to just try to move people in a direction where we can hopefully prevent FASD.